morning, everybody. My name is Leslie Ann Johnson. Happy New Year to you and welcome to this morning's post-cabinet press briefing, the first for 2021. We're happy to have you. If you're joining us on Channel 22, the Facebook and YouTube pages, and of course those of you in the diaspora and our colleagues via Zoom, good morning to you. We have with us here the Minister for Health and Social Security, the Honorable Nicholas Steele, the Acting Chief Medical Officer, Dr. Sean Charles, as well as the former Chief Medical Officer and former COVID Response Coordinator, Dr. George Mitchell. So, of course, we're talking health this morning. Without any further ado, I will hand you over to the Honorable Minister. Good morning.
Thank you, and good morning to you all of our viewers, listeners, members of the media. Happy New Year to you. This is our first press conference for the year, and I wish you all God's health and strength for 2021. We start this year marking, regrettably, our first COVID-19 death. We will give some more details on that and the contact tracing, etc., that has been going on from that, as well as our previous contact tracing activities, level of active cases right now, and what we can expect. Many of you, if not all of you, would have seen the most recent iteration of our regulations, that our curfew does continue from 8 to 5. There is a bit of an easement with respect to certain activities, but that we are still on alert. We are still at risk. We are not any different from our brothers and sisters in the region or our brothers and sisters in the world at large. Our hearts, our thoughts and prayers go out to our neighbors, as I'm sure they have concerns, and their thoughts and prayers go out towards us as well. I did announce over the weekend that I have asked for a committee to look into the most recent death, and let me be quite clear on it and the reason and rationale for it. This is the first death that Grenada has had related to COVID-19, and as such I think it is appropriate for us to have a team of individuals look into the entire circumstances, conditions, etc. This goes down on record as the first COVID-19 related death, and I think it's necessary for the team that has provided yeoman service for all of 2020 since this outbreak to avoid what many of us acknowledge as being an inevitability, to avoid as much as possible that inevitability, that they get the support from a team of their peers, as well as some legal support as there, to report back in terms of whether everything was done and confirming that all was done appropriately, to see where things could be strengthened, and to also have communication with the family. This would not be the first family that has to deal with COVID-19, nor the first Grenadian family that has to deal with a COVID-19 death, but it is the first Grenadian family to deal with a COVID-19 death in Grenada. And as such, I think it is appropriate to make sure that all of the levels, as best as possible, of support were there, are there, and continue to be there. Regrettably, we all must face the reality that this may not be the only death from COVID-19. I do hope so, that it may possibly be the only death that we have. But the only way that we can possibly get to a road of it being the only, or to continue to minimize the number of deaths we have, is to thoroughly look at the situation and circumstances surrounding this first death. And again, I want to say that I fully support the medical team. I give my full support wherever possible, should they need it, to the family as well, and that the intention of this committee is to make sure that we move forward stronger, better, confirming or strengthening any and all of our protocols that have brought us to this stage. Having said that, I would now hand over to Dr. Sean Charles and Dr. George Mitchell for their updates.
Yeah, I can go first. All right, good morning, everyone. So I think given the current mood and given that we've started 2021 by reaching a particular milestone in our response to COVID-19, I think I should start by laying out the present context that we are, dealing with, because sometimes, and I believe it is necessary for us to lay out the context of the situation that we're dealing with. COVID-19 has been declared a global pandemic sometime in March of 2020. And this disease has wreaked havoc right across the globe. I think as we stand, every single part of the world has been touched by this disease. So just to lay out the context a bit, I will present the following. To date, globally, and this is according to WHO figures, globally, there have been 84,233,579 confirmed cases of COVID. With regards to deaths, there have been 1,843,293 deaths, and that is globally. In the region of the Americas, where we live, there have so far been 36,943,000 cases, 943,389 cases, and 878,708 deaths. In the Caribbean, where we live as of yesterday, we recorded 367,851 cases and 5,936 deaths. Grenada, where we live, so far we have 130 confirmed cases, and as of Sunday we recorded our first death. We are not ignorant to the scenes that we have seen played out all across the world. This is the day that we have been working so hard to prevent. This is the scenario that we have been working hard and educating the public that may occur. Grenada is not immune. We have worked hard to ensure that we remain safe, but we are not immune. What is happening here is what has played out in many places across the world. And I have to admit that I was a bit puzzled at the reaction coming from some circles when we reported our first deaths. I think we are all somewhat knowledgeable of what is happening in the world. All right, we have now registered our first death. This is not the end of it. If we do not take COVID-19 seriously, it may happen again. This is not something that we welcome but it is an outcome that the world has been dealing with since the start of this pandemic. I am asking the public once again to be serious about COVID-19. Stop the noise. We are not immune. We are not special. If we are not careful, we can have the same scenario repeat over and over again. All right, I will stop there for now, and maybe later we can, have further discussions on this.
Good morning to all our listeners out there, both locally and in the diaspora. And I wish to join with the Minister and with the CMO in saying a Happy New Year to everyone, and to also join in saying how sympathetic we are on losing our first Grenadian on local territory, because we have lost many in the diaspora to COVID-19. And this is for us a fairly sad day. And as the Chief Medical Officer said a minute ago, this was a day that we were working to prevent all along. And we had this proud record of having zero death. And I felt proud, and I'm sure that many Grenadians felt proud as well, that whenever we looked at the column of death in terms of our data, it was proudly showing that we had no death. But we were conscious that if we did not take the necessary precautions and care, that one day, as they say, one day Congo te. And regrettably, we have lost the gentleman on Sunday. And my heartfelt sympathy, of course, goes out to the family, friends, well-wishers, persons who have known him as, persons do make impressions and marks on people, and we really, from a ministry point of view and from a COVID point of view, extend our condolences to the gentleman and his family. I wish to sort of like reiterate what the minister said, that the formation of the committee is principally and primarily to look at mechanisms and ways to ensure that as much as is practical, that we can put systems and mechanisms at play so that we can try and prevent more deaths related to COVID. And in general, I think the issue here is about putting systems in place. And I think the committee that has been announced is well placed to do just that. And when I looked at the cumulative or the amount of experience of the professionals that have been named, if my calculation is right, there is over 185 years of experience in that committee. Dr. Emma Harry Thompson, ex-CMO herself and prominent internal medicine specialist, is part of that. Everyone would know as well Dr. Beverly Nelson, pediatrician for almost time everlasting. She's part of the committee, and someone who I have worked with in recent times as part of quality assurance procedures and mechanisms. And we also have, of course, our current Chief Medical Officer and the Medical Director, Dr. Taisha Dolan, and Attorney at Law Lezian Sion. So within that committee, as I said, we have over 185 years of professional experience, and I think the team is well placed to come up with strong recommendations to ensure that as much as possible, and I keep reiterating, as much as possible, we can put mechanisms and make recommendations so that we don't have more of these COVID-related deaths, and in general, persons demising in Grenada in general. You can't stop that, but as much as we can prevent them, we are here to make the recommendations to do such. So I will now open the floor. I think, Leslie, back to you.
Thank you, Dr. Mitchell. Thank you, gentlemen. So, colleagues, you've heard from the Honorable Minister as well as the Chief Medical Officer and the former Chief Medical Officer. We now open the floor for questions. Nancy McGuire, good morning. You're first on the list.
Good morning. I have a couple of questions. There are Grenadians living abroad that are frontline workers, nurses, that have had vaccines, and I'm wondering what the protocols are for Grenadians and others that have been vaccinated in terms of arriving in Grenada. Will they have to go into quarantine? My second question is related to what are the plans, or are there plans for dealing with the vaccine whenever we get it? When are we going to get it? Have we made any decisions on that with our regional and international partners? Thank you.
Nancy, thank you for those two questions. I think those are extremely important and relevant questions right now. As we, when I say we, not just us in Grenada, but regionally, deal with this pandemic and all of the twists and turns that COVID-19 seems to throw at us, what's becoming more and more evident, not just to us but to the world, is that there needs to be a race to vaccination. And I want to repeat that, a race to vaccination to get past where we are now. With respect to individuals who have already been vaccinated and are looking to travel to Grenada, they will be treated the same as individuals who are not vaccinated at this point in time. Reason being, there is no certifiable way or acceptable international protocol to verify vaccination. Countries have started vaccinating frontline and at-risk persons, those who have access to manufacturing and have chosen unilaterally to take on a specific type of vaccine. But as yet, as a region and as a world, we do not have a vaccination certificate policy that we can, like we do with PCR testing, to be able to verify. And as the medical specialists have said as well, it is possible for a very short period for someone who is vaccinated to be contagious. So persons coming into Grenada, whether they've been vaccinated or not, would still have to follow the policy and protocols of quarantine at any point in time right now. Plans for vaccination, yes, as we have said previously, we, like most of our, if not all, of our CARICOM associates have signed off on the COVAX facility with Pan American Health Organization, WHO, and have said that we would be waiting for a WHO PAHO certified vaccine. What is becoming most evident to us and to our brothers and sisters and counterparts in other CARICOM countries is that we may not have the luxury of waiting for that. That in the same way, and I've said this previously, in the same way that certain countries who have acceptable Centers for Disease Control or capacity to make their own evaluations, whose evaluations would then lend to the WHO making its own decision because they are the members that will contribute the information, like Center for Disease Control in the United States, like Public Health Canada, like the NHS in the United Kingdom, like European Center for Disease Control, who have made unilateral decisions on certain vaccines. One of those vaccines has already been certified by WHO. That one, which is the Pfizer-BioNTech, has challenges logistically, not just for us, but for even the very same first world nations that are implementing it. You will see in today's headlines that there are questions in terms of the rate of implementation. It is because it needs what is referred to as extreme cold chain. It has to be kept at minus 72 degrees throughout its process, getting it here as well as storing it here before distribution. So it poses challenges. We haven't ruled that out. We have addressed and looked at what we would need to do to deal with the Pfizer-BioNTech if that is the one that we end up going with. There are other vaccines like the AstraZeneca that do not require that level of cold chain, that level of minus 72, that have a level of storage temperature-wise that we are accustomed dealing with, that we deal with right now with other vaccines and medications. So it is our desire to go that route. But I think what we have to recognize, and speaking to my other colleague health ministers as well, that they are making the same types of determinations, that we will rely on the WHO and its significant members, like the United States Center for Disease Control and like the UK and the others that I have named, and possibly choose one of those, which may happen in sync with a WHO recognition or may happen just before a WHO recognition of a vaccine. But that we do need to accelerate the process, and we are accelerating the process. By the end of this week, I will be able to give you further updates on the progress we have made with our vaccine, not just in getting it, but in accelerating its process of delivery to our nationals here.
So I wanted to add, with regard to the first question, until we have scientific evidence that the vaccine prevents infection and a person vaccinated cannot transmit the disease to someone who is not immune, our protocols will have to remain the same. At present, our best expectation is that the vaccine prevents disease, prevents someone from getting sick, and in particular prevents persons from having severe illness and as such reducing deaths. So until we have evidence that the vaccines prevent infection and a person who is vaccinated cannot transmit the disease if they're infected, our protocols would remain the same.
Thank you, gentlemen. Yes, the plans for the vaccination, yes.
Yeah, Nancy, just to address that, well, maybe Dr. Charles, you can speak to that in terms of the plan, because your plan doesn't just exist, but was also presented to Pan American Health Organization. It was the first plan from the region to be presented to Pan American Health Organization.
All right, so with regards to our plans, the main emphasis is on, one, selecting your priority groups for vaccination and determining the strategies that you will use to deploy the vaccines. Now, we know that there are different vaccine candidates, some that require ultra cold chain and others that use the regular cold chain 2 to 8 degrees Celsius. All right. So our plan addresses which of these vaccines that we have the capacity to deploy right now, and I can tell you, at present, we do not have the capacity to neither store or deploy the ultra cold chain, the vaccines that require ultra cold chain. That's those that require minus 80 degrees or so. In terms of the priority for vaccination, I believe I touched on that at a previous press conference, where because of our small health workforce, we need to protect them and to ensure that they are up and functioning and keep the system running. So our frontline workers, in particular our healthcare providers, will be our priority group for vaccination. Now, of course, there are persons who have underlying conditions. They are also high up in the priority for vaccination. The rollout, it all depends on the quantity of vaccines that we get to start with. If we get sufficient to do both our frontline workers and to offer coverage to persons at risk, we will do both. And of course, we would rely on our existing vaccination program to roll out the vaccines, of course, augmented by any additional support that will be required.
Leslie, and may I add a little here to this vaccination rollout program, and just to add on what Minister Steele has said just now, there are systems or organizational structures that have actually worked in terms of ensuring as much as possible that we get the best coverage. And our friends in Jamaica, I think, has the best practice right now. And, you know, in one of our COVID meetings, I recall Minister sort of like saying that we definitely need to adopt a similar approach and get a wide sort of like based organizational structure inclusive of representations from the trade union movement, from the churches, from, of course, St. George's University, the Medical Association, of course, NGOs, and even the opposition entities and parties in our country, and any such groups and organizations to be a part of this think tank, so that we're talking scientifically, we're not talking about anything else, we're talking about saving lives and coming up with recommendations that will ensure that we get or use the best available vaccines for our population. So that wide sort of like stakeholder group is what the thinking is in terms of our deployment of a vaccine in Grenada.
Thank you very much. Linda Straker, good morning.
Good morning and Happy New Year to all. I have, to start, I have about 3 questions. My first question has to do with, can the minister explain to us why the decision was taken to have a committee to examine and investigate the death of the gentleman instead of using our coroner's inquest law? Our coroner's inquest law provides for death that would happen at institutions. There's a whole range of reasons why a coroner's inquest can be conducted. Can you explain why the decision was taken to have a special committee instead of a coroner's inquest? Would you be able to tell us today whether or not the gentleman would have died at one of the health institutions? And my other question is to Dr. Sean for now. At 10 o'clock every day, I have programmed with the WHO to get the latest data around our region in particular. As of, according to the dashboard that came 10 o'clock this morning, it said at 4:54 on the 5th, which is today, Grenada has 163 cases, 1 death, and 29 new cases. Can you tell us how WHO would have come up with such a data and whether that data is wrong? That's my questions for now. I will have follow-up.
Yep, Linda, I thought I'd addressed that earlier, but let me reiterate. A coroner's inquest is when there is suspicion or reason to believe that there's wrongdoing, there's something that was murder or something like that, where there was negligence or so involved. I have said clearly, this is the country's first death related to COVID-19, and as such, it is extremely important to get all of the details on this for the record. For the record, for those who are providing that care and service, for all of us who are looking to avoid that possibility, and for the family as well. This would be the first Grenadian family to have to deal with the death of a loved one in Grenada. I've said it's not the first Grenadian family that has had to deal with the death of a loved one from COVID-19, but it's the first one in Grenada. And as such, I've asked this committee to look into all of the circumstances leading to this, not with any belief that there is some sort of malfeasance or some sort of incompetence or anything like that. This is the first COVID death. I have seen comments from the family, and I identify with their grief as well. And I've offered my full support to them, and whatever information is shared with me will be shared with them as well. And I think part of this committee's task as well is to deal with ensuring that the proper support is given to the family, because as I've said, this may not be the last family in Grenada to have a loved one succumb to COVID-19. So there is no rule book, playbook on this that we can follow clearly, and that's why I've asked, and Dr. George Mitchell has given the years of experience that the team has collectively, so that they can give us all as much information as possible. I still stand and will always stand with our medical team that is providing human service, our frontline workers that are providing human service. But in order to properly stand by them and continue to give them that support, this committee is going to look at all of the circumstances and give their comments on it.
So with regards to the question, the second question asked, the number of cases. Grenada has recorded 130 cases. If you see a number that is different to that, it is obviously an error. And there is no other way I can describe that scenario. All right, so it is 130 cases. I would say just follow up with the WHO. I am sure they will make the correction once they are alerted.
Yeah, let me add to that, Linda, that the WHO dashboard, as you say, is taken from the reporting that we give them. It's taken from the reporting that Dr. Sean Charles gives them. They collectively, take all of the information from everywhere else in the world, so it is possible that they may have an inaccuracy, or there usually has been a lag in that previously, and you have raised that and others have raised that with me, that WHO shows 2 less or 3 less than what we're announcing. Because it's when they get the figures from our reports that they will update. So Dr. Charles will make sure and correct that, as he is the official point of contact with that.
My other question had to do where he died.
He died at hospital, at General Hospital.
Thank you very much, Linda. So let's move on to Callistra Straker. Callistra Faria, good morning.
Good morning. Am I being heard?
Yes, you are. Go right ahead.
The gentleman who died, the COVID-related death, can you say whether the case, it was an imported case or an import-related case?
This case is being treated as an imported case. The gentleman fell sick within the incubation period of the disease. All right? He came in, he was in quarantine, he cleared quarantine, he developed symptoms within the incubation period, and he eventually succumbed to the illness. So this is treated as an imported case.
So, in that case, can you explain why? As far as I understand, you said, and you just said he was cleared, meaning he got a PCR negative test. Can you explain what happened there?
All right. You know, sometimes we need to explain this carefully and repeatedly. The incubation period for COVID-19 is between 2 to 14 days. The system that we have, we test at day 4, which will capture the majority of the cases that are infected. All right? But it will not capture 100%. Remember, there are persons that are going to present late. All right? As likely occurred in this setting. The individuals still continue to be within the incubation period, or the individual was within the incubation period when he fell sick. This is why our quarantine requirements are 14 days. Persons are released from the facility after they get a negative test, which is done on the 4th day. But it does not mean that they're completely out of the woods. They have to continue to observe the preventive measures up to the 14th day because they can present on day 14. As with this gentleman, it was day 11. It is something that can occur.
And so one of the issues that's been raised by family members of the gentleman, and you sort of spoke to them when you explained to me the whole issue of the incubation of the virus. Are we considering lengthening the period? Because while on paper we have a 14-day quarantine period, and that is well established, that on paper that's what it says. But the impression that people get, and what appears to be promoted, is that you get cleared. This is what the ministry says. You are cleared on after you take your swab, your day 4 swab, which comes within about 48 hours. So people expect that within 6 or 7 days they are cleared. This is what appears to be actively promoted by the Ministry of Health. Are you reconsidering that? And this is something that the family of the first COVID death is calling for as well.
Kalisha, let me address that, and to try to be as sensitive as possible, because I am identifying with the family that is grieving. Quarantine does not cure someone from COVID-19. Quarantine policies reduce the risk as best as possible from an individual coming in, infecting the rest of us. That is the reason for quarantine. Quarantine is not there for those who go into quarantine to cure them. Quarantine is there to protect as best as possible an individual coming in from the rest of us, i.e. that they do not infect us. At no point, any time, do we say that in coming to Grenada and quarantining you will be cured from COVID-19. It is that if you have to come to Grenada, you will quarantine so that we can reduce the risk as best as possible from infecting the rest of us. But even in quarantine, you have to interact with Grenadians. Getting to quarantine, landing at Morris Bishop International Airport, you have to interact with healthcare professionals. You have to interact with customs officer, immigration officer, airline personnel. So there is no, as Dr. Charles has said, there is no 100%. 100% is just to have people enter on their own and go straight into this quarantine with no interaction at all, and that is not possible. Quarantine does not cure you. Quarantine protects us as best as possible from individuals coming in.
Can I?
So just a quick follow-up, Minister. So as you've established, and I think we all understand that quarantine does not cure you. I don't think anybody believes that, including the family members that I mentioned. But the ministry clears people and they go about confident that they are clear. As far as I understand, this particular gentleman went about his business and so on. You spoke at length about people, about quarantine being to protect us. So understanding that quarantine is part of the major response for, and wearing your mask and washing your hands to protect us. But there seems to be a bit of a problem given the incubation period and the timeline within which the ministry gives people the confidence that they can walk around and so on. It's on those grounds, for the protection of us, I'm asking whether or not this is being reconsidered based on what has happened, given that the gentleman received a negative test, and as I understand, other people have received negative tests and turned out to be positive.
I would answer that question this way. If individuals feel, well, you remember I always start by saying the incubation period for COVID-19 is 2 to 14 days. I don't think that there should be an individual on this earth that does not understand that by now. When you are released from quarantine, it does not mean that everything is okay. It means that you have to continue observing the public health measures to ensure that if you do start displaying symptoms later, you are not a danger to the public. Or if you do become sick, you reach out to your healthcare provider. All right, so that you can be taken care of. All right, so if there's a perception that as soon as you are released from state quarantine, everything is good, I can tell you, and I want you to please convey that to your audience, that is a false perception. All right, it's been just about over a year since this this virus has been discovered. No one should be ignorant of the facts of this disease. Just turn on your TV and look and see what is occurring in the world. Educate yourself. Do not look for others to protect you and look after you. You must educate yourself. You cannot scapegoat out of this one, because you will put your family and yourself at risk. So if there's a false perception that as soon as you're released, you're okay, I am telling you today, that is a false perception. You need to continue to take care of yourself.
If you mind me just adding to that conversation, I think this underscores the fact and the points that we've been making throughout the pandemic about the dubious nature of the virus, and also the fact that it is really incumbent. It is our duty to ensure that we protect ourselves as well. And so the call for wearing of masks is not something that we do in a vacuum at all. It means that you're protecting yourself, and by so doing, protecting those who you live with, those who you socialize with. So that just in case you have, or we have a scenario like what the CMO just described, then we are protected as well. So the issue surrounding wearing of masks, the issue surrounding keeping your distancing, the issue surrounding sanitizing, and all of these measures are geared precisely to deal with such circumstances. It is virtually impossible for us to sit here and ensure that this happens throughout the length and breadth of the country. Yes, we are putting mechanisms in place monitoring mechanisms to ensure as much as possible that persons adhere to those measures. But at the end of the day, there is a responsibility on each one of us as we socialize to ensure that we do the right thing to protect ourselves, because we never know. We have said that we don't know everything about the virus, and we know more than we used to know at the onset of the virus, but we don't know everything. And, speaking about that, we're hearing about the new strain that is sort of like reaping havoc in the UK and other places. And so herein lies sort of like what we have said before. And we're learning about that. We're learning about its transmissibility and the fact that it's affecting more people. And maybe there are more things in relation to this virus that we don't know. So we ought to take the basic precautions that we have said and reiterated over and over again. That is our clarion call this morning as well.
Thank you very much. So let's move on now. Good morning, Mikey.
Good morning. Now, I think there's a certain level of danger in assuming that we have given enough information so that the average man should understand. And it's not really about people being oblivious to the fact, but in them clearly understanding what is required of them. And so I've heard, like Linda, Kalistra is saying, a lot of people are thinking, they have the perception that after the fourth day, they are free to roam. And even if that's not the truth, but is the ministry clear to these individuals what is required of them? And I think it's more than just observing the public health measures, because you are going to a home that includes children, older folks, and so on. So I think it should be more than just observing the wearing of the mask and so on. Is there more that we are asking of these people who are likely to be positive and not know it? But moving further from that, that's just a statement that I wanted to make. As it relates to the hotline, there are a lot of complaints that people are trying to get to the hotline and they are not able to do so. Is there an alternative way of getting to health officials in the event that they are not able to access you through the hotline?
Mikey, on the hotline, yes. Every time we strengthen and adjust the hotline, it gets inundated. Most recently, it was over the Christmas, New Year's, with the high amount of persons that had concerns of possibly being exposed to the cluster, the high amount of individuals that had traveled in, the high amount of individuals that were in isolation, as well as individuals who are just calling to request general questions or so. I do expect to have further announcements later on today, if not tomorrow, on further strengthening again that hotline system. This, as we have said from day one, is something that we are adapting to as quickly as possible. The hotline information part of it is one. The hotline reporting of concerns or possible cases or so is of particular importance to us all. So we need to make a separation, because there are persons calling. Just consider it like a 911 call then, and I think that's what it appropriately needs to be seen. But there are a significant number of people that are using that 911 to request information. So I'm not blaming them. We have to recognize that there's a need, so people are choosing to use that medium as well. So that's why we continually have to keep strengthening it. It is not that people aren't answering calls. Most definitely not. The ministry's senior personnel as well have been constantly answering calls. It is the level and the quantity of calls that we constantly have to keep upping the amount, and to now have some sort of screening process, further engagement of one of the call centers or so, in order to deal with a pre-screening, and then send all of the calls that are actually reporting possible cases or so to the ministry's personnel and deal with the general calls of just asking for information separately, so that we can, as Ministry of Health, get to speak to the persons who are calling for an emergency.
Okay.
May I add, Mikey, allow me to.
The committee.
Mikey,
Mikey?
just 1 second, please. 1 second, Mikey.
Mikey, are you listening to me? Yeah, I just wanted to add on the comments that the minister made. Indeed, the issue surrounding the hotlines have been, one of our sort of like biggest Achilles tendon in the last 2 or 3, not weeks, but I'd say last 2 weeks or so, and it was the subject of our COVID-19 committee on Sunday, and yes, we meet on Sunday at when it's necessary, and we met on Sunday, and it was an agenda item, and up until yesterday, Minister, the new system that you described has been tried out. A full report on its functionality will be given later on today. But, just to reassure the public that those are concerns that, yes, occupy our attention very much, and we're dealing with it. It is something that is developing, and as they develop, we are moving to restructure and to put systems in place. So yes, we are heeding the call, and I'm sure that when this one is resolved, we may have another issue to resolve, because that is the way the pandemic works, and that is the way this goes. We don't have the full-fledged script to foresee every single issue, and we're grateful for persons calling those systems out so that we can make the adjustment. I just wanted to add that here. Thank you.
Go ahead, Mikey.
Okay, I apologize. I wasn't able to hear Dr. Mitchell there, so I apologize for that.
That's okay. Go right
I was further asking about the committee itself. Are they appointed only to deal with the current death investigation, or are they mandated to do other things after the investigation has ended?
The committee is purely to deal with the first death. It is to gather as much facts as possible so that we can learn as much as possible, so that we can adjust as much as possible.
That's it, Mikey?
Okay, just one more question. As it relates to the Sandals investigation, is there an update for that, on that?
Mikey, my intention was just simply to offer my condolences today on the passing of the founder of Sandals, an individual who has made a tremendous impact, positive impact throughout the region. And my thoughts and prayers go with the family there in their most recent loss. Same way my thoughts and prayers go with the family of the individual who recently passed here in Grenada. And that we respect their time right now and put that aside. We can pick this up at any other point with respect to public statements. But my only public statement right now is going to be offering condolences to the family of Mr. Gordon Butch Stewart.
Thank you. So, colleagues, we're quickly running out of time, but we still have 2 people to take. That's Nisha Paul and Beverly Sinclair in that order. But I have one question quickly. Somebody is asking if there's a committee in place to follow up with persons after they've been cleared from quarantine.
There's a committee in place? No. There are clear instructions given to persons. Persons signed for 14 days quarantine. There are clear instructions to monitor and to report what is evident, and we admit that the ability of persons to call back in sometimes, and in this instance it appears, was extremely difficult, if not impossible, to do so by phone, because the very phone system was inundated with all the other calls that we were getting. So that has to be dealt with. But individuals are clearly told and signed to the instructions that they are to continue to monitor themselves for the 14 days.
All right, colleagues, Nisha Paul and then Beverly Sinclair. Nisha, good morning. All right, she's not there. Beverly Sinclair, good morning. Good morning. Nisha, Beverly, any one of you? We're running out of time quickly.
Good morning. Are you hearing?
Right, is that Nisha?
Hello?
Right, go right ahead. Good morning, go ahead.
Hello?
Nisha, we're hearing you. Go ahead.
Good morning. Good morning to everyone. Minister, I was hoping that you could maybe provide an update on the Sandals issue as well. But I heard the response you gave to Mikey's question. However, in light of the extension of the curfew and the delay in the reopening of schools and so on, I was wondering if maybe you'd be willing to provide to paint a picture as to what the sort of challenges that COVID-19 is having on these things right now, and specifically as it relates to the students at the Form 2 students at the secondary school in St. David. If you could provide an update as it relates to that, if possible. Thank you.
The challenges from COVID-19, I mean, you can just switch any TV on, look at any newspaper, not just here in Grenada, but throughout. There almost seems to be a parallel, because it is. It's the same pandemic that we are dealing with. With respect to schools, the Ministry of Education will be making an announcement later on today. The Minister of Education did ask me to announce that before the close, but since you've raised the close of this press conference, but since you've raised the issue of a school, just simply to say that the Ministry of Education will be making a statement later on today with respect to schools. The challenges are immense for any and all countries with vast resources. First world nations, the most powerful nation in the world, is trying to deal with as best as possible. The most protected individuals in the world, in the most protected institution in the world, the White House, has succumbed to this virus as well. We should not expect to be any different. The countries that have a full 14-day quarantine do so in most cases on an honor system as well. And if you listen to their local media and comments on social media, etc., you will see that they have had breaches in their 14 days. The longer you keep somebody in, the harder it is to keep them there. The more are the negative effects of that as well. So there is absolutely no perfect system at present anywhere in the world. And I do not say that just simply to say that we should accept any of the shortcomings of this ministry. No. The facts are there is no perfect system anywhere in the world, and we, this ministry, like any and all other ministries of health and governments, are dealing with the situation as best we can. The one thing in common with most of us, if not all of us, from a medical standpoint, public health standpoint, is that we say the best thing that anyone can do is to maintain social distancing, wear your masks, avoid large gatherings, do not conduct activities that would put you at risk, as best as possible. Avoid large gatherings, wear your mask, sanitize your hands. You will see, and you can check, that there are individuals in Grenada now that can say categorically that they were in direct contact with a COVID-19 positive individual, but that they were not infected because they were following the protocols. Our health team, our frontline team has swabbed every single person that tested positive. They have come in direct physical contact with all 130 positive cases to date. But they are able to protect themselves as best as possible by following the protocols. The protocols work. The breaches in the protocols are what put us at risk. Should we go to a 14-day quarantine? Should we close the borders? None of those have worked elsewhere either. We will, like other countries, find the best that we can do and the best balance that we can have. And we will, like most countries, get to the end of this as well. But we, like all countries, do not have a perfect system. I will be the first to say so. We have consistently said our border protection is not perfect. That is why prior to December, throughout, even before we opened our borders, we were still requesting individuals to wear their masks. We were still requesting individuals to avoid large gatherings. We are still requesting individuals to practice hand sanitizing, maintain the 6-foot distancing. With borders closed or with borders open, it is necessary to have that, because there's no perfect way of closing these borders. With borders open, it's necessary to have that too, because there's no perfect way of opening up these borders. But we have to deal with what is necessary right now, and the most necessary thing is for all of us to take a personal responsibility of protecting ourselves and our loved ones.
Thank you, Minister. Beverly Sinclair, good morning. We're coming back to you. Beverly? Bev, good morning. Are you there? All right, so
yes, I am here, but I'm barely hearing you, Leslie.
Okay, yes, but I'm hearing you, so you just go right ahead.
Okay. Good morning, colleagues. Good morning, Minister and your team. I also want to offer my condolences to the family who has lost a member. And my question specifically to the Minister is about the committee that has been set up. Well, not this committee in particular, but Minister, isn't there supposed to be a standing committee that looks at all deaths that happen within the public healthcare system and keep a log, keep a report, so that the systems can be improved?
That's your question, Bev. The answer to that is yes, and that committee is doing what they're supposed to do. That's separate from the individuals that I have just asked to give information. I've been being very specific. The committee that there is a committee that deals with any and all deaths, a review committee, any and all deaths at the General Hospital or any of our healthcare facilities, and that committee is doing their work independent. That committee is independent of the minister. I cannot tell them to speed up, to not to do or to do. That happens automatically. So too does a coroner's inquiry or anything like that. That's not at the instruction and only at the convenience of the Minister of Health. So let me reiterate, I have said clearly, because this is the first COVID-19 related death in Grenada, I have asked a group of individuals with significant medical and legal experience to give a report on everything so that we can learn as much as possible, as quickly as possible. The time frame for that is 1 week. The other inquests or committees and so work in their time lines based on whatever information they need to get, etc. Sometimes faster, sometimes slower than that. And they don't necessarily report to the minister. But I have asked this committee to give us information by the end of this week, as much information as possible surrounding our first COVID-19 death, because it is the first death in Grenada from this new disease, so that we can learn as much as possible, give as much support as possible to our healthcare providers as well as the families, and God forbid, future families as well.
Bev, you have a quick follow-up question?
I do. I just want to know, is it their confidence in the existing committee that they could have done this and expedited in the week to give you a report?
But the existing committee operates independent of. I have asked this committee to give me, as minister, a report. The individual, the committees that deal with any and all deaths within the public health system deal with exactly that, any and all deaths within the public health system. They are not going to focus on social support for the healthcare worker or the family. They're not going to focus on COVID-19 protocols. They're not going to focus on quarantine. They're not going to focus on the ability of the family to communicate to us or us to communicate to the family. They're not going to focus on whether family members or contacts have been cleared, are positive or not positive for COVID-19. They're not going to focus on those things. They're going to focus specifically on the medical care. Being a little more open-minded on this, that this is a new disease, I've asked this committee to give a report specific to the fact that this is the first COVID-19. And therefore there are the other things that I've just raised that they will hopefully comment on, that are not dealt with normally in a death review or a coroner's inquest.
Thank you very much. So our final question this morning, because we have run out of time, from GBN: how do you plan to deal with the body of the COVID victim in terms of disposal?
Cremation. Yeah.
There is a protocol in place. The family has cooperated fully. We give support to that, and I have been in direct communication with family members to express my support, my condolences, and will continue to be. But with respect to a COVID-19 related death, the procedure is, and the protocol is, cremation.
Thank you very much, gentlemen and colleagues. So we have come to the end. We'll just give you a minute now to say any final words that you may have. I'll start with you, Dr. Mitchell, and come around.
Yes, thank you, Leslie. Once again, I want to say Happy New Year to our listeners out there. And in particular, I want to express or reiterate my condolences to the family of the gentleman who lost his life. And all Grenadians out there who are, in a similar position. We have many Grenadians out there in the U.S. and the United Kingdom who are experiencing similar grief at the moment. So, and in particular, this case in Grenada, I want to express my condolences to the family. I want to also take this time to shout out our healthcare providers. They have been doing tremendous job over the time. Sometimes we forget if we don't have a press conference to mention them, not only related to COVID but otherwise. And as a former chief medical officer, I know what it means to be in the trenches. As a former house officer, DMO, district medical officer, and way up, I know what it means to be working out there. And also all frontline workers. In recent times, we have had to call on the RGPF to function again and, to do a tremendous job. Hospital staff in particular. And in recent times, the folks at the health desk have played a tremendous role in ensuring that our mechanisms and our protocols and our system work. So I want to sort of like, say how happy the committee is to do that. And lastly, in terms of the mandate that the minister has given the committee and appointed me as chair, I want to say that this role will be taken seriously. I've already contacted the committee members, and we're going to work assiduously to ensure that we come up with the best recommendations to confront this pandemic, looking at all sides of the circumstances to ensure that we are in the best possible place going forward in dealing with this pandemic. So once again, thank you.
Thank you, Dr. Mitchell. Dr. Charles?
I would just like to end by saying we are all in this together. All right, we are all in this together. We have come a long way. We've hit some bumps along the road. We've hit similar milestones to other countries that are dealing with this pandemic. But at the end of the day, we are all in this together. We are all in the same boat. We all must cooperate if we are to stay afloat. The public, your responsibility is to stay informed. The Ministry of Health, of course, is not the only source of information to educate yourself regarding the disease. We will do our best to inform you of what is happening in the country, what are the steps that you need to take in order to protect yourself and protect your family. And we will continue to work hard to ensure that persons remain safe and healthy. But we require of the public, please educate yourself. And please listen and follow the protocols in order to avoid getting infected and avoid future deaths. The question as to whether a person with COVID in Grenada can die has been answered. All right, so that question is no longer hanging in the air. If you get this disease, you can die. If you get this disease, you can pass it on to a family member who can die. So we require the public to be a little more disciplined. Stay informed. Look what is happening throughout the world. Look at the UK has just gone into a strict lockdown. Look at the fact that you now require a PCR test to go to the US and to Canada. Each points to the fact that things are not getting better immediately, despite the fact that the world has started vaccinating. Things are not going to get better immediately. So that's why countries are intensifying the public health efforts to protect their populations. Take this disease seriously. I get the feeling that there are lots of persons who still do not take this disease seriously. Look what is happening elsewhere. This is not something you want to happen in your country. To our media, I want you to assist us as well. I take note of the question as persons may not understand yet that they need to wear a mask or they need to avoid scenarios where they put themselves at risk and then they carry the disease back home to their family. That is where the media, we're asking for your help. Help us get the message out there, because it seems that there are persons that we have not reached as yet. All right? So that is my request. All right? And to our frontline workers, yes, we have hit a grim milestone, but do not be disheartened. All right? Do not lose hope. Let us continue to work as hard as we have since the start of this, to ensure that this situation does not happen again. We understand that right now the public is confused. All right, and a lot of the time they direct some of their misguided confusion at our frontline workers who are fighting hard and who have been fighting hard to ensure that we all remain safe. I say continue to fight the good fight. We will eventually conquer this disease. The world will get past this pandemic. And the time for rest and quiet and celebration will come. But it's just that there's quite a bit more work to be done. All right? And I thank you for getting us this far without this outcome that we were discussing, which is a death. And I know that we will work twice as hard to ensure that the next one is avoided. But at the same time, we are not God. We can only do our best, but at the end of the day, we are not God. Thank you.
Thank you very much. Honorable Minister.
Thank you, Leslie Ann. And just to I think continue where Dr. Charles has just left off, in that at every junction in this journey through this pandemic, we have had to deal with the questions being raised, criticisms, and we have dealt with it, and we expect it to continue. We expect it to continue. Grenada is not unique in that. Similar forms of criticism, questions, etc., are laid on healthcare professionals or governments all over the world. Those who remain closed, if there are any, are being criticized for doing so. Those who are open are being criticized for being open. Those who have protective or restrictive measures are being criticized for having protective, restrictive measures, or being criticized for not having enough. We as a people and we as a government here are not any different. There is absolutely no direction that this government, like any other government, can take that will not bring some form of criticism from some sector of our society. Close, don't close. Open, don't open. Curfew, no curfew. Schools open, schools should close. Financial support, too much financial support. Wearing the mask, too much wearing of the mask. Inquest, asking for more facts so that we can learn more. Why not a coroner's inquiry? Too much information, not enough information. Too harsh, not harsh enough. Too critical, not critical enough. I've even had individuals comment or question or criticize what I wear to some of these press conferences. So I've gotten accustomed to it. Not immune to it, but accustomed to it. So too you will find members of this team and our healthcare practitioners. They've gotten accustomed but they are not immune. So they need to continue to have our support. What we have to recognize is that there is no right or wrong way to get through this pandemic, because there is no playbook, and that we are all mortal beings, and as such we all have our strengths and weaknesses. Those of us who are outside of the health system and relying on the health system, and those of us in particular who are part of the health system, giving the support as best as possible to the nation. So my thoughts and prayers remain with the family and families who have lost loved ones. My thoughts and prayers go out to the families who have lost significant income. We are responsible as well to them. My thoughts and prayers go out to those individuals who continue to be under significant psychological pressure as well, which in many instances are our very healthcare providers, who tried as best as possible with all of the resources that they have at hand to save this individual's life, as well as any and all of the individuals who enter our healthcare system, with or without COVID-19. So we need to recognize going forward that we have not found the magic pill for COVID-19. But if we continue to focus on everything negative, we will continue to have to come and defend what is positive in this. What is positive in this is that we as a nation, little Grenada, has done extremely well when compared with the rest of the world. But like the rest of the world, little Grenada is not perfect. Little Grenada will get through this. With this government, with this healthcare team, with this team of media personalities, with the citizens that we have and the resources that we have. Let us focus in 2021 as we look forward to what has to come in 2021 to getting out of these woods. Let us focus on the vaccine that is necessary, the public discourse that must be had on that. Let us focus on keeping each other safe. Let us focus on those who need financial, moral, psychological support for whatever their reason. Loss of a loved one, loss of job, loss of income, having to deal with curfew, restricted movements, etc., and constantly hearing this gloom and doom, not just from us, but from almost every television station, news station, social media platform, etc., as well as the confusion that we sometimes create with disinformation and misinformation on those same platforms. But those are the realities of today. This is the world we live in. Just let us try to have a little more understanding and more of a human and humane face to each other in 2021. Thank you.
Thank you very much, Honorable Minister for Health and Social Security, Nicholas Steele, Acting Chief Medical Officer, Dr. Sean Charles, and the former Chief Medical Officer and former COVID-19 Response Coordinator, Dr. George Mitchell. We thank you so much, colleagues, joining us via Zoom. We thank you as well as those of you in the diaspora and those of you who joined us on Channel 22 or Facebook and YouTube pages. Have a great day, everybody. Thank you.
pure Grenada, the spice of the Caribbean, endeavors to be a positive source of inspiration for those dreaming of travel. We invite you to dream with us wherever you are. Dream about sipping a fresh fruity cocktail and sticking your toes into the warm white sand at Grandance Beach. Dream about snorkeling at the world's first underwater sculpture park at Molinaire. And dream about taking a dip under the cool, cascading Concord waterfall. We are Grenada, dreaming of welcoming you back to our shores. With love, from Grenada, Carriacou, and Petite Martinique.
COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy. To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal. When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.
Hello, these are your government notices for today, Tuesday, January 5th, 2021. I am Caroline Peters. Commissioner of Police Edwin Martin has been confirmed to the post of Chief of Police after acting in the position since July 2018. The Commissioner received his letter of appointment from the Public Service Commission. Commenting on his confirmation to the post, Commissioner Martin said this appointment is dedicated to awesome, hardworking and dedicated men and women of the force. Ms. Dia Forrester has commenced duties as the newly appointed Attorney General. She is the first female to be appointed Attorney General in Grenada. Ms. Forrester served as the Solicitor General of Grenada from April 2019 to December 2020. Commencing her legal career on being called to the bar in Grenada in 2008, Ms. Forrester has distinguished legal career working locally and in other regional countries. She brings to the position a wealth of experience in complex financial transactions and major litigation matters. The Commonwealth Scholarship Commission in the United Kingdom, in collaboration with the Government of Grenada, is offering master's scholarships for suitable and qualified individuals, tenable at universities in the United Kingdom, commencing September 2021. The Government of Grenada Commonwealth Scholarship form must be completed and submitted along with the relevant documents to the Human Resource Development Division at the Ministry of Education, Human Resource Development, Religious Affairs and Information at the Botanical Gardens, Tantine, St. George's on or before Friday, January 8th, 2021. For additional information, please contact the Scholarship Desk on telephone number 440-3767 or 417-9762. The Ministry of Agriculture, Lands and Forestry wishes to inform the public of the closure of the hunting season. This will remain in effect until September 30th, 2021. Animals that should not be hunted during the closed period are as follows: manikou, tattoo, monkey, iguana, and ramier. The ministry cautions that hunting during the closed season carries a penalty of $1,000 or a term of 6 months imprisonment. And now for your government reminder. The general public is reminded that the following payments can now be made via the online platform pay.gov.gd: motor vehicle license, driver's license, property tax, examination fees, driver's exam and learner's permit, police record, and marriage license. Persons are encouraged to use this platform as the Ministry of Finance continues to work towards improving its service delivery and facilitate tax compliance. These have been your government notices for today, Tuesday, January 5th, 2021. I am Caroline Peters. Until next time.
Government says nightly curfew continues with allowance to restaurants to resume dine-in service. We'll have details to this story and more in the National Report. With the details to the news for Monday, January 4th, 2021, I am Rakisha St. Louis. The nightly curfew in Grenada will continue for another week. This decision was taken at Monday's cabinet meeting. The 8 p.m. to 5 a.m. curfew is intended to limit the level of nighttime movement and social activities as the country seeks to manage the potential spread of COVID-19. Prime Minister and Minister of National Security, Dr. the Right Honorable Keith Mitchell, said he believes the country is on the right path with a significant decline in COVID-19 cases following the recent spike with the detection of a cluster. However, he noted that government must maintain the restriction on social activities to help reduce the level of active COVID-19 cases. Although the curfew remains in effect, under the new regulations, restaurants are permitted to resume dine-in services within the allowed hours of operation. Proprietors must, however, strictly adhere to the COVID-19 protocols, ensuring full compliance with the recommended physical distance and the daily log, which will facilitate prompt and efficient contact tracing should that become necessary. Restaurant owners and operators are further advised that operations must cease within a suitable time frame that will allow staff to commute home before 8 p.m. The public is also advised that the ban on all commercial flights between Grenada and the United Kingdom will remain in effect until January 11, 2021. All residents are encouraged to comply with the current regulations and are reminded to follow the recommended COVID-19 protocols. Wash or sanitize hands frequently, maintain social distance, and wear a mask at all times in public spaces. Continuing the news, the government of Grenada has appointed a committee to examine all the details surrounding the passing of a 72-year-old male who became the country's first COVID-19 related death. Following Sunday's announcement of the death of the patient who had recent travel history, the Ministry of Health indicated that it will seek to ascertain all of the facts relating to the case. As such, a committee has been appointed to spearhead that investigation. It comprises of representatives from both the public and private sectors. The committee is chaired by Dr. George Mitchell and includes Dr. Emma Harry Thompson, Dr. Beverly Nelson, Dr. Sean Charles, Dr. Taisha Donnell, and Leslie Ann Sion, who is the deputy chair. The committee has been given 1 week to determine all of the facts and present a report to the cabinet. Meanwhile, both the Minister of Health and Social Security, Honorable Nicholas Steele, and the Minister responsible for Hospital Services and Community Health Services, Honorable Delma Thomas, have been in direct contact with the family of the deceased to extend sympathy on behalf of the government of Grenada. Additionally, the Ministry of Health is moving ahead with contact tracing efforts and has so far determined that 27 persons were potentially exposed to this latest case. All of these persons have already been tested, and the ministry is currently awaiting their results. As of January 3rd, 2021, the Ministry of Health has on record 6 active COVID-19 cases. A total of 129 cases have been recorded in Grenada thus far. Dia Forrester, a practicing attorney for the past 12 years, has been appointed as Grenada's Attorney General effective January 1st, 2021. Ms. Forrester, who was called to the Grenada Bar in 2008, is the country's first female Attorney General and has a wealth of experience practicing in St. Kitts and Nevis and Anguilla, where she held the position of partner in the prominent civil and commercial law firm Daniel Brantley. Forrester returned to Grenada in April 2019 to serve as the country's Solicitor General. During an interview with the GIS, Forrester stated that she believed the timing was right to serve her country.
I always consider that if I am going to return to Grenada, it would not be viable for me to return merely in private practice and settle. I have a consistent need to serve people, and I think that itself, when I came in as an SG, it gave me the opportunity to serve a cross-section of people, but of course, as an SG itself, you are serving the entire country, you're serving the government, you're serving all of the ministries and all of these different things. So that scope was very important to me to have, and I'm so thankful that I have done that itself, and I hope persons have appreciated the contributions I have made and that I will continue to make.
Being approached to hold the position of Attorney General is one that Forrester says has renewed her thrust to deliver a service to her country that will be in keeping with the law of the land.
I do so with the comfort of knowing that the law is the law, the Constitution is the Constitution. Critics will criticize, but more importantly, what is good and right and just will always prevail. I am clear in the task ahead of me, and it is not lost on me the significance of the occasion, because I do understand that I am probably indeed the first female Attorney General, so I should take a moment to thank all of the women who came before me and would have laid the foundation for me to be where I am today, and likewise my present group of female warriors who keep me grounded and keep me conscious that I must do my best at all times. And of course, that means I must serve without fear or favor. I am thankful for the confidence bestowed in me by the Prime Minister and the Cabinet and his government. And what I can say to individuals is that my work speaks for itself.
Ms. Forrester holds a Master of Laws degree in International Banking and Finance Law from University College London, a Legal Education Certificate of Merit from the Hugh Wooden Law School, and a Bachelor of Laws degree with honours from the University of the West Indies, Caville campus. The new Attorney General told the GIS that it is very important that she does her job well, taking into consideration the sacrifices made by family and others in getting her to the level she is at in her career to date. This is the National Report. The news will continue after the break.
Hey, are you gonna wear your mask today? You see everywhere you go, there are rules you got to follow, so don't you say COVID-19 will delay. Take the opportunity to save your community. Don't be that guy, put a mask on your face if you're heading outside. 'Cause It's your life, my life, more lives will be taken if we don't try. If you feel any symptoms, call the hotline. Stay inside until you feel fine. 6 feet away every day. Keep COVID-19 far from away. Keep Grenada safe. Be COVID-19 smart.
Welcome back. The Royal Grenada Police Force is providing better visibility for motorists through the installation of LED reflectors on large speed bumps. The solar-powered lights have already been installed on bumps in Bushaju, Woodlands, River Road, and St. David. Head of the Traffic Department, Superintendent Randy Connaught, told GIS the intention is to place the lights island-wide. He said the initiative came about through assessments carried out by the RGPF. Installation of the lights is just the beginning of moves by the force to enhance visibility.
We are working closely with the Ministry of Infrastructure to install these lights on some of the speed bumps across the island. It is our intention to look at the entire length and breadth of the state in order to ensure that there is even distribution of the lights on those critical bumps that are larger than the normal speed bumps that we are accustomed to. Now, the feedback has been very encouraging. Most of the motorists are now seeing the speed bumps way in advance, and this would also complement an initiative to ensure that those speed bumps, warning signs, are placed way ahead of those speed bumps to give notice to the motoring public.
The Traffic Department is collaborating with the Ministry of Infrastructure Development to implement other methods to ensure safety for the populace.
From discussion with the Transport Authority, we can reasonably expect within the new year the deployment of adequate warning signs ahead of speed bumps and many of the other signs that are critical for motorists along the public roadway. So we are looking forward with great anticipation for the continued support from the Ministry of Infrastructure. They are the ones responsible for procuring those road signs, but we have done the surveys along with them, and we are moving with great anticipation, hoping that in the coming year we can have greater enhancement of our road signs along the public thoroughfare.
Finally, in the news, the Ministry of Education is the recipient of 100 tablets donated by the Answer McCall Group of Companies. The tablets will be used in the ministry's e-learning initiative, which includes the distribution of devices to students and teachers at primary and secondary schools. Minister for Education, Human Resource Development, Religious Affairs and Information, Honorable Emmeline Pear, expressed deep appreciation to the advancement and development of the education sector and for continued support.
I want to briefly just first of all express our deepest appreciation to the Answer McCall Foundation for what I consider not just a gesture that is timely, but one which is very much in line with the advancement, the development as it relates to education. And I don't want to put it in line with COVID only, but I want to put it in line with the sort of transformation that we should be speaking about in terms of education and where we are going. We recognize that without the support of corporate sponsors, companies that are generous in understanding the importance of education, if we're speaking about sustainable development of our country and we don't speak education, we're in a lot of trouble. And so this contribution here will go a long way, not just in dealing with the challenge of COVID-19, but the whole transformation of the landscape of education and the future of our country. So it is with a very, very big heart of thanks that I speak this morning and to appeal to the Answer McCall Foundation. Do not stop.
Chief Education Officer Mrs. Angela Finley gives the assurance that the devices will be distributed to students in need and will be used to optimize their learning. Ron Antoine, representative from the Answer McCall Group of Companies, said his company is happy to contribute towards the development of the nation's future.
As the Answer McCall Group of Companies, we recognize that we all have to pull together to really make this a success. So I first want to recognize the good work by the Ministry of Education, the teachers, all the frontline workers. And we are, in fact, happy to make this contribution today to aid in this effect. The Ansamacal Foundation is, in fact, an arm of the Ansamacal Group of Companies. Here in Grenada, we have 2 companies existing. That's Grenada Breweries and Sissons Paint Grenada. And we're really happy to play our part. This is just a beginning. We hope to do more. We hope that the challenge of COVID in particular will not be with us for very long. But we also recognize that it's here, and in fact, the need, in fact, is urgent.
The Ministry of Education resumes the distribution of laptops to primary school teachers on Tuesday, January 5th. Laptops have already been distributed to several teachers island-wide at the end of the term in December. That story just ended the national report for today, Monday, January 4th. Let's recap the top story. Government says nightly curfew continues with allowance to restaurants to resume dine-in service. On behalf of the entire news and production team, I am Rikisha St. Louis saying thank you for joining us. Until next time.